Hello friends, welcome to Kavita Medico's Education, and today's disease condition is peptic ulcer disease. So before starting the definition, let's see the term peptic ulcer. So peptic means a proteolytic enzyme which get converted into pepsin in the presence of HCl, and this pepsin will digest the protein. Okay, so this term is taken from the proteolytic enzyme which helps in the digestion of protein. If this proteolytic or pepsin enzyme will digest our stomach, that is known as ulcer. Okay, so it will form a ulcer or wound in our stomach, that is known as peptic ulcer disease. So this peptic ulcer disease takes place into our GI system. So basically we have 4 layers in our GI system. Okay, so I will start from the outermost layer. So the outermost layer is known as serosa layer. Okay, it helps the organ to place in a position. Okay, it will intact the organ into a one position. Next we have muscularis layer. In this layer there are muscles present. Next we have submucosal layer which have nerves, blood supply, and certain kinds of chemicals, okay, which will support the mucosa layer. So this mucosa layer is the innermost layer into our GI system. Okay, and this mucosa layer will come into the contact of food. Okay, when the food will get digested or when the food will get churned into our stomach, then this mucosa layer will come into the contact of food. Okay, if due to any condition this mucosa layer get degenerated or there is a discontinuity in this mucosa layer, then it is known as peptic ulcer disease condition. So you have to understood that there are 4 layers in our GI system, and the innermost layer is the mucosa layer. Again, this mucosa layer have 3 sub-layer. Okay, this have 3 sub-layer, and the number 1 we have epithelial sub-layer. Okay, if there is a break in this epithelial layer, then what will happen? A ulcer, a sore, a wound will get form in our stomach. Okay, that is known as peptic ulcer disease condition. Now let's see the term definition of this peptic ulcer. So it is a break in continuity. So there is a disintegration or there is a break in the continuity of the mucosa layer. Okay, so due to the break of this mucosa layer, a open sore will develop into our GI system. Okay, into our stomach, a sore will develop, or we can say that there is an ulcer formation into our stomach. Okay, this ulcer is a similar kind of ulcer which takes place into our mouth also. Okay, and you have heard about decubitus ulcer or the ulcer which get into the bedridden patient. The same kind of ulcer will occur into our GI system. So why this ulcer is occurring? There is a discontinuity or there is a break in the mucosa layer. Okay, so due to the break in the mucosa layer, a open sore or a wound will form into our stomach in lower esophagus. So this ulcer can occur into our esophagus region also. It can also occur in our stomach region, that is known as gastric ulcer, and in the duodenum. Okay, in the first part of our small intestine, that is known as duodenum. So this ulcer can occur or this wound can occur anywhere into our GI system due to contact with the gastric acid and pepsin. Why the ulcer is occurring into our mucosa layer? Because when our layer is coming into the contact of this gastric acid and pepsin. Okay, if the layer is very weak or due to H. pylori bacteria, if the layer get weak, then our own enzymes, our own stomach or GI system enzyme will degenerate. Okay, or they will break the mucosa layer. So this ulcer is occurring due to the gastric acid and pepsin which are released into our stomach when the food get digested or when the food get churned into our stomach. Okay, so what is happening in ulcer? There is a discontinuity or there is a break in the mucosa layer due to which an open wound or sore is developed into our mucosa layer, that is known as peptic ulcer. So here peptic ulcer is an umbrella term, means it's a broad term. Okay, only stomach is not included in this condition. There are certain organs are included of our GI system. Number 1 we have gastric ulcer. If this ulcer will occur into our stomach region, that is known as gastric ulcer. So in which area of our stomach this ulcer will occur? So here I have shown you the diagram of stomach in which I have divided the stomach in various parts. So this is the esophagus region. Okay, so the this part of this esophagus which is coming in contact with the stomach is known as cardia region. Okay, and in the esophagus and stomach we have cardiac muscles. Okay, this cardiac muscles will prevent the food from going back into our esophagus. Okay, from going back into our esophagus region. Okay, it will prevent the regurgitation process. Okay, so this region is known as cardia region, and the upper portion of the stomach is known as fundus region. This one is known as fundus region, and this is middle one is known as body of our stomach, and this lower one is known as pyloric antrum. Here I have marked the pyloric antrum. Okay, so this lower end is known as pyloric antrum, and in the pyloric antrum we have pyloric sphincter muscles. Okay, these muscles will prevent the food from going into the small intestine. Okay, when the food will get digested completely into our stomach, then only it will move into our small intestine for the absorption process. Okay, so here in the pyloric antrum region we have sphincter muscles which will prevent the food from going into the small intestine. So these are the areas of our stomach. So mainly in the stomach region, it will occur in the lesser curvature in the anterior region. Okay, so you have to understand that there are two portions of our stomach. This portion is known as, okay, I'm just marking that portion. So this portion is known as lesser curvature of our stomach. Okay, and this greater one is known as greater curvature of our stomach. If this ulcer will occur, mostly the ulcer of stomach will occur in the pyloric antrum area. Okay, so mostly the ulcer will occur in the pyloric antrum region of the lesser curvature of our stomach. Okay, so mostly ulcers seen in the pyloric antrum region. So I am marking the ulcer here in the lesser curvature region, that is known as gastric ulcer. So ulcer will occur in stomach, that is known as gastric ulcer. Next we have duodenal ulcer. So the ulcer will also occur in our duodenum area. So in which portion of our duodenum? In the first part. Okay, in the first part of our duodenum the ulcer will occur, that is known as first portion of duodenum the ulcer will occur. Okay, and we have esophageal ulcer. Esophageal means if the ulcer will occur in the esophagus region, that is known as esophageal ulcer, and it is occurring due to the GERD disease condition. GERD means if there is a reflection of food into our esophagus, that is known as gastroesophageal reflux disease. If the food get regurgitated into our esophagus, that is known as esophageal ulcer. Because in this food we have HCl also, there is a pepsin also, there is an acidic region. Okay, there is an acidic secretion in that food. If this food will go back into our esophagus area, then it will form a ulcer or a wound into our esophagus area also. Okay, so mostly the ulcer occurs in the duodenum area. There are 75% chances, or there are 75% people who are suffering from mostly from the duodenal ulcer. So duodenal ulcer is 4 times, duodenum region is 4 times more than the stomach region. Okay, so ulcer will occur mostly in the duodenum region. It is the much prone area for the ulcer accretion. Okay, so duodenum is the most prone area, and in the gastric region we have only 15% area. Okay, for 15% chances of occurring the ulcer, and in the esophagus we have only 5% chances of occurring the ulcer if the person is having a GERD disease condition, that is known as gastroesophageal reflux disease condition. Next, see, these are the areas of degeneration. So how the ulcer occur? There will be degeneration will form in that area. Okay, see, if this is our mucosa layer. Okay, so in mucosa we have some mucosa layer also, and in our stomach we have columnar epithelial cells. Okay, so mucosa have again 3 sub layers, in which the outermost is the columnar epithelial layer. Okay, and in this columnar epithelial cell we have several gastric glands. Okay, from these gastric glands have certain kinds of cells which secretes the various things into our stomach. Okay, like the chief cell will secrete the pepsinogen. Okay, and the other cell will secrete the HCl, and other will secrete the other enzymes into our stomach. Okay, so the ulcer will occur if there is a break in the mucosal layer. So this ulcer will form as a degenerated area. Okay, there is a degeneration into that area, there is an inflammation into that area, and there is a necrosis. Necrosis word is very important. Okay, so there is a necrosis formation in that area, where in the gastrointestinal mucosa. Okay, so what kind of ulcer there will form? It will be degenerated ulcer. There is an inflammation in the ulcer. There is a necrosis in the tissue or in the cells of our stomach. Okay, in the GI system, in the GI mucosa, in the mucosa layer of our stomach, mostly the epithelial layer of our stomach. Next, see. So again, you can also say this definition like if there is an imbalance will occur. Okay, nature have formed everything in a balanced form. Okay, if there is an imbalance will occur in the protective factors and in the degenerative factors, then ulcer will occur. See, peptic ulcer occurs when the normal balance between factors that promote mucosal injury. So there are certain kind of factor which will do the degeneration or which will disturb the mucosal region, and they will do the degeneration or they will do the injury in the mucosal layer. So what are those factors? So there are some degenerative factors, okay, which will harm the mucosa and which will promote the mucosal injury. What are those factors? Those are gastric acid, that is HCl, pepsinogen enzyme which get converted into pepsine and it will digest the protein. Next we have pepsine, next we have H. pylori. So there are certain kinds of bacteria, okay, which will degenerate or which will break the mucosa. And if person is taking a lot of painkiller medicine like NSAIDs means non-steroidal anti-inflammatory drugs. If you are taking a non-steroidal anti-inflammatory drugs for a long period of time, then this ulcer will occur. And if someone is doing smoking and alcohol for a chronic period of time, then again the ulcer will occur. So these all are the degenerative factors for ulcer accretion. And the factors that promote the mucosa, again we have other factors which will help the mucosa in the regeneration process. Okay, they will prevent the degeneration in the mucosa. So what are those factors which will protect the mucosa? Those are intact epithelium. So we have a continuous epithelium layer into our GI system. So there is an intact epithelium which will prevent the breaking of mucosa layer. We have mucus. Okay, so mucus is very good for our stomach because this mucus will help the mucosa layer to do not get break. Okay, so this mucus is very important into our stomach. It will prevent the mucosal degeneration. Next we have bicarbonate ions, we have base here. Okay, so why there is a bicarbonate ion secretion? For balancing the HCl, for balancing the hydrochloric acid. Okay, certain kinds of prostaglandin chemicals which will secrete the bicarbonate ions, they will increase the amount of mucosa so that we can prevent the mucosa layer from breaking. Okay, so we have bicarbonate ion, we have mucosa blood flow, and we have epithelial regeneration. So our epithelium layer have a capacity of regeneration again. So is disrupted when the balance between the factors which are promoting mucosal injury and the factors which are protecting the mucus will get disbalanced. Okay, this thing will get disrupted, then again the ulcer will occur. Suppose if these factors, this mucosa, bicarbonate, epithelial regeneration will not occur, or there is a low resistance of this mucosa layer and these factors are more, okay, they are in a high form, like there is a gastric acid in a more form, there is a H. pylori bacteria, and there is a chronic condition of smoking and alcohol, then the patient will suffer from the ulcer disease condition. Next we see an ulcer occur when the lining of the mucosa membrane of these organ eroded. Means when the inner lining, okay, when the upper lining of the epithelial layer will get eroded or it will get degenerated to the point that epithelium is exposed. Means the epithelium layer is getting exposed. Okay, when the gastric acid and pepsine will degenerate this epithelium layer, okay, the epithelium layer is exposed, then what will happen? A bleeding or a wound or ulcer will occur. Okay, sometimes this ulcer can also get deeper into our other layer also, that is known as perforation. If this ulcer or wound is occurring in the superficial area, in the upper layer only, that is okay. But sometimes this ulcer get deep into other areas or other layers of our stomach, that is known as perforation. And due to this perforation, a bleeding can also occur into the patient. Okay. Again, you can also say this, that the ulcer will occur when there is a decreased resistance of mucosa. When this intact mucosa or intact epithelium layer get resistance, when the resistance of this mucosa layer get decreased, then also the ulcer will occur. Okay. So you have understood what is peptic ulcer disease. it's a ulcer or wound into our GI system, mainly in the three areas of our GI system. First, we have esophagus region due to GERD disease condition. Next, we have lesser curvature area of our pyloric antrum stomach, and next we have first part of our duodenum. So this was the definition of peptic ulcer disease condition. Next, we have layers of alimentary canal or stomach wall. Okay, so our alimentary canal is started from our esophagus up to the anus region, and it contains 4 layers. So why I have written stomach wall here? Because the peptic ulcer takes place into our stomach area and into the duodenum region. So we will discuss the 4 layers of alimentary canal, which are the same layer which are present into our stomach also. Okay, so there are mainly 4 layers in our stomach. So first we have mucosa layer. So mucosa is the innermost layer. Okay, so this diagram which I have shown through the red, okay, in the zigzag form, that is known as mucosa layer. So this is the innermost layer of our stomach. So suppose this hollow region is the lumen or empty space where the food is digested. Okay, this empty space is known as the lumen of our stomach, where the digestion of food take place. Okay, and our stomach is covered by the 4 layer, and the innermost layer is known as the mucosa layer. Okay, so it is the innermost layer and comes in contact with the food. So when we will eat the food, and it will go into our stomach, so this mucosa layer will come into the contact of food, because this is the innermost layer in our stomach area. Okay, so it will come into the contact of food whenever the food get digested into our stomach. It secretes the digestive enzyme, and this is the layer which will secrete the digestive juices and digestive enzymes. Okay, and it will secrete the HCl also. So you understood? So the inner layer which I have shown with this red zigzag motion, it is our mucosa layer, and it will secrete the digestive juices and digestive enzymes and HCl, which help in the digestion of food. The mucosa has fold called gastric gland. So this mucosa layer is in a fold way. Okay, so this mucosa will form a fold into our stomach, and these folds are known as gastric glands. Okay, and this fold will contain the gastric glands. Okay, called gastric glands. So these fold of mucosa are known as gastric glands that contains specialized cell. In this gastric glands, there are different kinds of cells are present. There are different specialized cells are present, which will secrete out the different digestive enzymes and different digestive juices. And it will open into a stomach cavity by gastric pits. Now when these juices will release out from this specialized cell, then these secretion will come into the lumen or into the empty area of our stomach through the gastric pits. So there are holes or gastric pits are present into the lumen area. Through these gastric pits and hole, the gastric secretion and HCl or pepsin will come into our stomach area. The mucosa has 3 sublayers. Again, this mucosa is divided into 3 sublayers. Okay, this mucosa is formed by the 3 sublayers. So what are these layers? First we have epithelium layer, next we have lamina layer, and next we have muscularis layer. So this mucosa is formed by the 3 sublayers. Okay, the epithelium layer of mucosa folds inward into the lamina propria to form gastric pits. So how the gastric pits are generated into the stomach area? When this epithelium layer of our mucosa will get fold inward, means inside. Okay, so when this epithelium layer will get folded or diverted into our lamina propria, then they will form the gastric gland or gastric pits. Okay, single layer of columnar epithelium cells or mucus cells secrete the thick layer of mucus. Okay, again they are secreting the digestive juices and digestive enzymes, and again this epithelial layer which is formed by the columnar cell, this columnar cell will secrete the mucus, and this thick mucus will protect the mucosa layer from digestion by the HCl, pepsin and digestive enzymes. Okay, so this epithelial layer contains a specialized kind of cell that is known as columnar cell or foveolar cell, and this columnar or foveolar cell will secrete the thick mucus which will protect the mucosa layer from the digestion. Okay, when the food is digesting into our stomach, when the food is getting churned out into our stomach, then this columnar epithelium will secrete the mucus, a thick layer of mucus, which will protect our mucosa layer. Okay, and it will also secrete the bicarbonate ions. Why? This bicarbonate ion will balance the HCl. Okay, so when the base will be secreted by this columnar epithelial cell, then it will balance the acidic nature of the HCl. Okay, so there are two roles of columnar epithelial cell. First, they are getting folded into lamina propria and they will form gastric glands and gastric pits. And again, this columnar or foveolar cells are secreting out the mucus. This mucus is protecting the mucosa layer, okay, and it is secreting the bicarbonate ions, and this bicarbonate ions will balance the acidic content of our stomach. Next layer we have in our stomach, that is known as submucosa. Okay, so submucosa layer is shown by this diagram. So this is the second layer. Okay, so consists of connective tissue. So this submucosa layer is formed by the connective tissue. It have nerve supply, it have lymph supply, it have blood supply. Okay, so this blood and lymph supply I have shown through this dot. Okay, so the function of this submucosa is to provide the nutrients to the mucosa. So this submucosa will give the nutritional benefits to the mucosa. Okay, so this sublayer will supply the nutrients or nutrition to the mucosa layer. Okay, because it contains the blood, nerves, and lymph supply. So they will give the rich nutrition to the mucosa layer. Next we have muscularis layer. So name is indicating muscularis. It means this layer is formed by the muscles. Okay, so it has three smooth muscles. So this muscularis layer is formed by the three smooth muscles. So what are those muscles? First we have inner oblique muscle is present. Next we have middle circular layer, and next we have outer longitudinal muscles. So this muscularis is again formed by the three layers, and these are the name. First we have inner oblique, next we have circular, and next we have longitudinal muscles. So what is the role of this muscularis layer? So it helps in mixing and churning food to form a chyme. Okay, so this muscle layer will mix out the food, it will digest the food, and it will churn the food, and it will form a substance that is known as chyme. Chyme is a semi-solid food. Chyme is a semi-solid food. So this muscle layer will do a contraction, which will digest the food, which will churn out the food, and it will convert that solid food into the semi-solid form. That is known as chyme. Semi-solid food is known as chyme. Okay, and it will also do one more function. It will squeeze the stomach. Okay, so it will do the contraction or peristaltic movement. We can say that peristaltic movement. Okay, so it will do the peristaltic movement, or it will squeeze the stomach, and it will move the food to the small intestine in the form of bowel. Okay, so a small amount of food will be passed into our small intestine. Okay, when the food gets fully digested, when it gets churned out, then this muscularis layer will do a contraction, and it will push the food into our small intestine for the absorption process. Okay, little amount of digestion also takes place into our intestine. So it will push the food into our small intestine in the form of bowel. Next, the last layer we have serosa layer. Okay, this is shown through this red diagram. Okay, so this is the outermost layer in our stomach, that is known as serosa. It is the strongest layer of our stomach, and it consists of connective tissue. Okay, this layer is formed by the connective tissue, means it will do a balance. Okay, it will protect the stomach. Okay, so it is formed by the connective tissue. It protects and cover the stomach and reduce friction with other organs. Okay, it will help the stomach to remain in a place. Okay, it will help the stomach to get attached to the peritoneum cavity. Okay, it will give a firmness and attachment to the stomach into a one place. Okay, and it will also reduce the friction with the other organs, because in our peritoneum cavity there are other organs are also present. So it will stop, or it will reduce the friction with the other organ also. So these are our alimentary canal layer or stomach wall layer. So next we have classification of ulcers and types of ulcers. So how ulcers are classified? So it is classified according to the location at which position of GI tract the ulcer is present, and on the basis of clinical features it is divided, and on the basis of number, okay, how many ulcers are present. So in this type, ulcers are classified. So first we will discuss about the based on location. Okay, location means at which position of GI tract the ulcer is present. So here on the basis of position or on the basis of location, it is again divided into three types. First we have gastric ulcer, that is 15%. Next we have duodenal ulcer, that is 80%. And next we have esophageal ulcer. Okay, so one by one we will discuss. So on the basis of location, location means at which position of GI tract the ulcer is present. So here we are talking about gastric ulcer. So the chances of occurring gastric ulcer is about 15%. So it can occur, okay, in our stomach. Gastric means in the stomach region. So if we talk about stomach, so how it is divided, okay. So this portion which is above the stomach, that is known as esophagus, and this is our cardia region, okay. This is our cardia region, and here we have cardiac sphincter muscles. Here we have cardiac sphincter muscles, and then this portion is known as fundus, okay. This upper portion is known as fundus, and this is the body of stomach. And after the body we have pylorus region. This is called as pylorus antrum region. After the pylorus we have pyloric sphincter muscles, okay. It will prevent the food from going into the small intestine, and the part of intestine, small intestine, that is known as duodenum, okay. It is the first part of our intestine. So this portion is known as our duodenum. So it is divided like this. So the ulcer which occur in our stomach, that is 15% ulcer occur in our stomach, that is known as gastric ulcer. So common site is pylorus antrum. So they will occur mostly at the pyloric region, okay. So this is our pyloric region. So here the ulcer will occur. So this is the pylorus region, and here we will have ulcer, and it will occur in the lesser curvature, okay. So this is the lesser curvature portion of stomach, the inward one, and outer we have outward portion, that is known as greater curvature. So it will occur in the pyloric region, in the lesser curvature, okay. Pain increases after eating. So when the patient will eat the food, he will have the meal, then this food will come into our stomach. So what will happen? Whenever the food comes into the stomach, the digestive enzymes like pepsin, HCl will secrete out, okay, and they will churn the food, they will digest the food. So in our stomach, the digestion process will happen. So whenever the food will come into our stomach, then this food will stimulate the acid secretion. Due to the food, our acid gets secreted, our digestive enzymes get secreted. Now this food in which acid HCl is present, this food will come into the contact of inner layer. We have read about the layers, and our innermost layer we have mucosal layer. This is the mucosal layer, okay. So the food contains the HCl, and when this HCl contained food will come into the contact of mucosa, then this HCl will irritate this mucosa layer. So we have read about that there are around 4 layers in our GI system. So the innermost layer which I have shown here, that is mucosa, then we have submucosa, and then we have muscularis, and then we have serosa, okay. So the inner layer, mucosa, always comes into the contact of food, okay. Then some mucosa contains the lymph vessels, they contain the nerves, they contain the blood supply, okay. It will supply the nutrition to the mucosa layer. Then we have muscularis, the muscles layer which help in the contraction, and it will push the food in the small intestine. And we have serosa, that is intact layer, okay. It will help the stomach to remain in one position. So what is happening in this gastric ulcer? So when this food will come into the contact with mucosa, then what will happen? It will irritate the mucosa. If the protective factors are less, we have read about the balance. If the protective factors are less and the destructive factors are more, then what will happen? This mucosa will slow down, okay. This mucosa will break, okay. There is a low resistance power of this mucosa. So the HCl means acid, which is present in our food, it will degrade the mucosa layer. It will do the inflammation, it will do the irritation into our mucosa layer, and ulcer will occur in our stomach, okay. So this happens into our, where it is happening? It is happening into our pyloric region of our stomach. So patient feel that whenever he is taking food, he is getting a pain in stomach. Okay, so in this condition, patient do not eat food. Okay, he will skip the meal, he will not eat the food, because when he is taking the food, he is having epigastric pain, because our stomach is situated in our epigastric region. Okay, so he will avoid the food, and due to which he have a severe weight loss condition in gastric ulcer. And it mostly occur in other middle aged peoples. Who are the middle aged people? The people who are above 40 years of age, and in the elderly, means in the old age peoples it will occur. Okay, now let's talk about the duodenal ulcer. So duodenal ulcer is the most occurring ulcer. Here I have written about 80%. Okay, so the ulcer which is most, the peptic ulcer, if we talk about peptic ulcer, so duodenal ulcer is the most common occurring ulcer. So more common than gastric ulcer. Okay, it is more common than our gastric ulcer. About 80% of ulcer occur in our duodenum region. So after the pylorus, this is the pylorus, then we have pyloric sphincter muscles, then we have duodenum. Okay, so in the first portion of our small intestine, that is duodenum, it will occur. Okay, it is more than gastric ulcer. It occurs in the first part of duodenum. So in duodenum, it will occur in which part? In the first part. Again, the duodenum is divided into three parts. Okay, so it will occur after the pylorus in 1.5 centimeter range. Okay, this is a 1.5 centimeter range of duodenum. So here this ulcer will occur in the duodenum region, and most ulcers are found here only. Okay, so this I have shown you a duodenal ulcer. Okay, pain decreases after eating. So here, whenever the patient will take food, he will have less pain. Why it is happening? Okay, and this pain will return after 2 to 3 hours late or at night. So here, when the patient is taking food, then he will not have any pain. Why it is happening? See, when he will take the food, this food will go into our stomach, and digestive enzymes, pepsin and HCl, will digest the food. While the food is digesting into our stomach, this pyloric sphincter muscle will become closed. Okay, the pyloric sphincter muscles will get closed. Now this food which contains the HCl will not go into the duodenum. That's why the patient will have no pain while he will have food. Okay, because you all know that our small intestine and our large intestine secretes the base. Okay, they secretes the bicarbonate ions. They are the base. So the food will be digested in the stomach, and pyloric sphincter muscle will get closed. Now that acid contained food is not coming into the duodenum, and here the ulcer is not getting irritated. Okay, so patient will have no pain. So he thinks that whenever he will eat more and more food, then the pain will not happen. Okay, but this pain will occur after 2 to 3 hours. Okay, why? Because after 2 to 3 hours our food get digested. Okay, it converted into the chyme form, it converted into the semi-solid form. Now this semi-solid food or chyme will come into our duodenum. Okay, and that food contains the HCl. Now after 2 to 3 hours it will irritate the duodenum. So whenever at midnight patient wakes up due to the pain, because at 9 p.m. suppose he have taken the dinner. Okay, so when food get digested after 3 hours, then at midnight he will suffer from the pain. Okay, so pain comes here after 2 to 3 hours. Okay, so in this condition, in duodenal ulcer, patient thinks that if he will have more and more food, then he will not have pain. But this pain will occur after 2 to 3 hours of digested food or of a chyme food, when it will come into our duodenum region. Now we have one more, that is esophageal ulcer. It is a less common ulcer. Okay, it hardly or rarely occur. So occurs in lower esophagus. It will occur in the lower esophageal region. This is the cardia. Okay, so when the food will get reflux back, okay, when the food will go back into our esophagus, then this ulcer will occur, because it will irritate the mucosa layer of our esophagus. Okay, you all know that our GI tract is start from our esophagus to the anus region, and all have same layer, mucosa, submucosa, muscularis and serosa. So when this food will reflux back, it will go backward into our esophagus, then it will irritate the esophagus, okay, in the cardia region. So it occurs due to GRD, mostly the patient who are suffering from gastroesophageal reflux disease. Okay, so this is a disease due to which this food will come into our esophagus region. So the ulcer Okay, it's a rare form of ulcer which will occur in our cardia region. So these were the ulcer which are based on the location, on the position of ulcer on our GI tract. Now let's talk about the clinical features. Okay, so on the basis of clinical features, again it is subdivided. We have acute ulcer and we have chronic peptic ulcer. So acute means the ulcer which will occur suddenly. Okay, this type of ulcers occur suddenly and it will get healed by itself. Okay, it will get healed by itself or by some treatment. So here what is written, superficial involves only the mucosal layer. So acute ulcer occurs suddenly and it will only involve the superficial layer. So which is the superficial layer? Mucosa. So it will involve only the mucosal layer. Okay, it will not go deep into the other layers. So this is the mucosal layer. So it will happen into this layer only. Okay, so this is acute ulcer and may heal completely without scarring. So there will be no scar. When this ulcer will heal by itself, it will not form any scar, any fibrosis. Okay, and it is occurring only in the mucosa layer and it's a short form of ulcer. That is why we called it as an acute ulcer, a sudden occurring ulcer, okay, which will heal by itself and there will be no scar and no fibrosis formed. That is called as acute ulcer. Now we have chronic. So by the name of chronic means it's a long lasting ulcer. Okay, chronic. So it's a deep and long lasting ulcer. So this ulcer can damage our other layer also. So this ulcer can penetrate. Okay, it is penetrating into the submucosa also. Okay, it can also penetrate to the muscularis also. Okay, if this ulcer will occur into the deep layers of a layer of a tissue, then what will happen? It will do a perforation here. It will do a hole in the stomach. So due to the hole in the stomach, what will happen? There will be bleeding. Patient will have a complication of bleeding also. So deep and long lasting. So it's a deep ulcer, means all the layers are involved in this process. Mucosa layer. It involves both the mucosa and submucosa layer. Okay. If ulcer penetrate the stomach, okay, if it is coming out from the stomach, that it will involve the adjacent organs. So which are the adjacent organs around the stomach? Pancreas. So it will also damage our pancreas and patient will have complication of bleeding also. So it is a most dangerous ulcer, that is chronic ulcer. Now we have last, based on numbers. Numbers means how many ulcers are there. Either it is 1 or 2. Okay, so on the basis of number we have single ulcer. Single means only one ulcer is there. So about 80 to 90% ulcers are solitary. Okay, so the ulcer which are occurring, just one ulcer, that is about 80 to 90%. So 80 to 90% people suffer from the single ulcer. Okay, so it can occur in stomach or it can occur either in duodenum. Okay, so it can occur anywhere, but only one ulcer will occur, usually round or oval in shape, localized pain. So how you will diagnose it? So we can diagnose that it is the type of ulcer by seeing the ulcer. We can see if the ulcer is round in shape. Okay, if the ulcer have no cut, it is round or it is an oval in shape and it have sharp edges. Okay, if the ulcer has sharp edges and it is round and oval in shape, then it is single ulcer. Okay, and patient will have a localized pain. Means the pain is not in deformed form. Okay, he will have a pain in a single region. Suppose he is talking about epigastric pain, it means patient will have pain only in epigastric region. So there is a localized pain. Now we have multiple ulcer. So on the basis of number, we have divided the ulcer into 3 categories. Next we have multiple ulcer. Okay, multiple means 2 and more ulcers are occurring in the same part of our GI tract or in different region of our GI tract. Okay, so same means 2 ulcers are occurring in our stomach, that is multiple ulcer, and it can also happen that 1 ulcer will occur in our stomach and 1 will occur in our duodenum. It is also a multiple ulcer. Okay, so if the ulcer is 2 and more ulcer which are occurring in the same organ or on different organ, it will come into a multiple ulcer. Okay, here patient will have a severe pain. Okay, patient will have an intense pain. Okay, he will talk about intense pain, he will have a severe pain, and this is a recurrent form of ulcer also. It means if the ulcer will get healed, then it will recover. Okay, it will come back again and again after healing also. Okay, that is multiple ulcer. Next, at the last, we have recurrent ulcer. As the name is indicating recurrent, it means the thing which is coming again and again. That is called as recurrent ulcer. So repair after healing means the ulcer is completely healed now, but after some days or some time, it will occur at same position or can also recur at different position. Okay. So in gastric occur at same site. So in the gastric, mostly we have seen that in gastric region, it will occur at the same site. Suppose this ulcer is healed and it is treated completely, but after some year, after some month, it will reoccur back. Okay. So in most in stomach region, we have seen that it reoccur at the same point. But in duodenum, it can reoccur at different points. Okay. So in duodenum, it can either occur in this region or at this region also. So these were the classification and types of peptic ulcer. So next we have causes and risk factor for peptic ulcer disease condition. So the main cause for this disease condition is Helicobacter pylori bacteria. Okay, so it's a gram-negative bacteria which is spiral in shape. So this bacteria enter into our stomach by the oral to oral route way and by fecal-oral route. Okay, so this bacteria enters the body through the food, water and saliva which is contaminated. Okay, if we are living in an unhygienic condition and unsanitary condition, then this bacteria can enter into our stomach. So this bacteria enter by the oral to oral route and by fecal-oral route into our body. And it's a gram-negative bacteria which is in spiral shaped. This is the main causative agent which will cause the peptic ulcer disease condition. Now, this bacteria is surviving into our stomach. How it is surviving? Okay, because our stomach contains the acidic environment, it contains the pepsin, it contains the HCl. But again, this bacteria is surviving into our stomach. How it is possible? Because this bacteria produces an enzyme that is known as urease. Okay, so it is producing an enzyme that is known as urease. Now this urease enzyme will break the urea which is present into our body into ammonia and CO2. Okay, so it is forming ammonia, that is NH3 and CO2 gas. Okay, so this ammonia is a alkaline thing. Okay, this ammonia is a basic content. So this ammonia will neutralize our stomach acid. Okay, so it's a clever kind of bacteria which is surviving into our stomach because this bacteria is releasing an enzyme that is known as urease. Okay, this urease enzyme again breaking the urea into ammonia and CO2. Okay, and you all know that this ammonia is a basic content. Okay, it's an alkaline content. So this ammonia will neutralize our stomach acid. Now this bacteria can easily live into our stomach. So this allows H. pylori. Now this bacteria will live into our stomach. Okay, it will proliferate there, it will multiply there. Okay, beneath the mucosa. So this bacteria is surviving into our mucosal layer, which is the innermost layer of our stomach or GI tract. This bacteria will living into our mucosal layer, beneath the mucosal layer, and it will proliferate there, it will multiply there. Okay, so it's surviving into our stomach because it have neutralized the stomach acid. Now, duodenum, again in stomach as well as in duodenum, anywhere this bacteria can live. So to compensate for this, stomach makes more acid. Now the stomach environment is neutralized. So for compensating this neutralized environment, our stomach will make more and more acid. Okay, for increasing the acidic content of our stomach. So for compensating this neutralizing environment, our stomach is making more and more acid. It also releases toxins. And remember just one thing, this bacteria also release a toxin that is known as cytotoxin. Okay, this is a clever kind of bacteria. It will also release a toxin that is known as cytotoxin. So what is the full form of the cytotoxin? Cyto means cell and toxin means damage. Okay, so it is releasing a poison, it is releasing a toxic content. Those toxic content are CAG-A and VAC-A. CAG, CAG-A and VAC, VAC. Okay, so it is releasing two kinds of cytotoxin that is known as CAG-A and VAC-A. These toxin will damage the epithelial cell or foveolar cell. Okay, so these toxins will damage our epithelial and foveolar cells. These cells are making the protective barrier for our stomach. Because these cells are secreting the stomach, these cells are secreting the mucus and bicarbonates. These mucus and bicarbonates are protective barrier for our stomach. Okay, so it's a clever kind of bacteria which will neutralize the acidic environment of stomach by secreting, by converting the urea into ammonia, and it is releasing the cytotoxin. Okay, CAG and VAC, these cytotoxin will damage our cell. Okay, so these cytotoxin will do a damaging effect into our epithelial cell, into the mucosa layer. Okay, now the protective barriers are weak. Okay, so these protective barriers are weak, and easily what will happen, easily the pepsin and HCl will damage our mucosa layer. So the HCl and pepsin which is released, they will easily damage the mucosa layer now. Okay, so in starting form, the patient will suffer from gastritis. Gastritis means inflammation of the stomach, and slowly if this bacteria will present there, it will convert this gastritis into peptic ulcer disease, and it will damage the mucosal cell. Okay, it will get down the mucosal cell necrosis, mucosal cell degeneration, and it will weak our mucosal barrier. Okay, so it's a clever kind of bacteria. So the main causative agent for peptic ulcer disease condition is H. pylori bacteria. Next important, we have NSAIDs. Okay, NSAIDs are non-steroidal anti-inflammatory drugs. These are the painkillers. Okay, if you are taking painkillers for a long period of time, for a chronic period of time, then these painkillers are very harmful for your body. How? Let me explain you. We have painkillers like aspirin, ibuprofen, and diclofenac. Okay, so these are some painkillers. If you are consuming painkillers for a long period of time, then this painkiller will inhibit the enzyme that is known as cyclooxygenase. Okay, these NSAIDs or painkiller will inhibit, okay, will decrease, okay, or will stop the cyclooxygenase enzyme, and these enzymes are released from our cell. Now, these cycloenzyme will decrease the prostaglandin into our body, and you all know that these prostaglandins are very helpful for our GI tract. How they are so helpful? These prostaglandin are very helpful for our GI tract because this prostaglandin secretes mucus for our mucosal layer. Okay, they secrete the thick mucus coating into our GI tract, and they secrete the bicarbonate ions. Okay, they are the protective barrier, and they increase the blood flow into our four layer of our GI tract, into the mucosal layer, especially into the mucosal layer. So it increases the blood flow into our mucosal layer. It help in the regeneration capacity of epithelial cell. Okay, it help in the regeneration process. But due to the consumption of heavy NSAIDs for a chronic period of time, these NSAIDs will inhibit the prostaglandin. Okay, by secreting, by inhibiting the enzyme that is known as cyclooxygenase. This cyclooxygenase enzyme will inhibit the prostaglandin synthesis. If this prostaglandin is decreased, then what will happen? Automatically all the function will be decreased, like there will be less mucus production. Okay, because prostaglandin is decreased, okay, which will decrease the mucus production into and bicarbonate production into our stomach. It will decrease the mucosal blood flow. If mucosal blood flow is low or less, then the mucus layer will not able to get the proper oxygen and nutrition supply. Okay, and it will not able to secrete the mucus and bicarbonate ions, and it will decrease, again it will decrease the cell regeneration capacity. Okay, it will decrease the cell regeneration capacity. So these were the harmful effect of NSAIDs drug. Next we have Zollinger-Ellison syndrome. Okay, so it's a rare kind of tumor. Only 1 to 2% of people suffer from this disease condition. So it's a Zollinger-Ellison syndrome. In this syndrome, what happens? A tumor gets formed. Okay, tumor means a gastrinoma. Okay, tumor is a kind of gastrinoma. So a tumor is formed, a carcinoma is formed. Okay, this tumor can be in a benign form also or in a malignant form also. Just remember, 99% of peptic ulcer are in a benign cancer. Only 1% of peptic ulcer converts into a malignant form of tumor. Okay, so this is a rare kind of disease, in which a tumor will develop into our pancreas and into the duodenum. Okay, this gastrinoma cancer or tumor will secrete a hormone that is known as gastrin hormone. Okay, and you all know that this gastrin hormone is released from our G cell, and the role of this gastrin hormone is to stimulate the parietal cell. Okay, so this gastrin hormone will do a stimulation into our parietal cell, and parietal cell secrete the gastric acid that is also known as HCl. So understood what is happening in Zolliger-Ellison syndrome. So in Zolliger-Ellison syndrome, a tumor is forming into our pancreas and duodenum, and this tumor is secreting a hormone that is known as gastrinoma hormone. This gastrinoma hormone is stimulating our parietal cell, and from parietal cell more and more acid is being released, which will lead to peptic ulcer. Next we have smoking. Smoking contains a nicotine substance. Okay, this nicotine will do inflammation into our mucosal layer. Okay, it will decrease the blood supply into our mucosal layer. Okay, alcohol. If we are drinking alcohol for a long period of time, for a chronic period of time, then this alcohol will directly do a damaging effect into our mucosal layer. Okay, it will do a irritation into our mucosal layer. So alcohol consumption is very harmful. Next we have tobacco. Tobacco contains the nicotine again. Okay, this nicotine will decrease the cell regeneration capacity of epithelial cell. Okay, it will decrease the blood flow into our epithelial cell. Next we have tea and coffee. If we are consuming a lot of tea and coffee, okay, so if we are drinking regularly on the basis of 5 to 6 cup of coffee daily, then it will again produce a lot of acid into our stomach. Okay, next we have extensive burn condition. So people who get burn, okay, so the people who get burn about 30%, means if the person body is burned about more than 30%, then he will suffer from curling ulcer. Okay, so the people who get burn, they suffer from curling ulcer disease condition. So what is happening in the burn condition? So burn is the most painful and most pathetic condition of the disease. Okay, so burn is a very painful condition. So in burn, the patient will suffer from curling ulcer. So how curling ulcer are developed in the patient? So what is happening in the burn? In burn, the excessive fluid is lost from the body. Okay, so it is due to massive fluid loss. So in burn condition, a massive amount of fluid is lost from the body. Okay, if the fluid level is decreased into our body, that condition is known as hypovolemia. Hypovolemia means, here I am writing hypovolemia. Hypovolemia means low amount of fluid into our body. If our body contains low amount of fluid, then what will happen? Automatically our blood flow will be decreased. Okay, in burn patient, the patient suffer from massive fluid loss condition. They suffer from hypovolemia condition, and due to this hypovolemia, blood flow will be low. Okay, so blood flow will be low to the organs of GI tract like stomach and duodenum, and these organs, stomach and duodenum, will not able to get proper oxygen and nutrition, due to which their cell will die. Okay, that condition is known as ischemia. Ischemia means a condition in which cell and tissue do not get proper supply of oxygen. Okay, that condition is known as ischemia. So due to decreased blood flow to the stomach and duodenum, there will be lack of oxygen and nutrition to the epithelial or mucosal cell of stomach and duodenum, due to which they will not able to perform their function properly, and it will lead into a cell injury condition, into a necrosis condition, and slowly what will happen? Those cell and tissue will get degenerated, and they will go into a process that is known as necrosis. Okay, necrosis means cell death condition. Okay, which will decrease mucus production and bicarbonate production. These mucus and bicarbonate are protective barrier for our GI tract, for our stomach and duodenum. Next we have psychological stress. Here it is written psychological. Psychological means a stress which is in our mind. Okay, so some people used to take lot of stress. So a lot of stress condition is very harmful. Okay, some people are very emotional. Okay, that emotional condition is very harmful. So the stress which is triggered into our mental health, okay, it will also secrete a lot of acid production into our stomach. So it's a harmful condition. Next we have intracranial lesions. Intracranial lesions means a wound into our mind, lesions, those are known as lesions. Okay, so intracranial lesion means our ICP is increased, okay, due to which the patient will suffer from Cushing ulcer disease condition. Okay, Cushing ulcer. So what is happening in intracranial lesions? Developing from hyperacidity following excessive vagal stimulation. So due to this intracranial lesions, a vagal stimulation will occur. Okay, our vagus nerve will get stimulated, and this vagus nerve will produce a hormone that is known as acetylcholine, that is also known as ACH, that is a short form. Okay, so this intracranial lesion will cause Cushing ulcer. How? Because in intracranial lesions, the ICP will increase and it will do a stimulation to our vagus nerve. And this vagus nerve will do a stimulation to the acetylcholine release. Okay. And this ACH hormone will trigger our parietal cell. And again, our parietal cell secrete lot of pepsin and HCl content. Okay. And this HCl will damage our stomach. Next, we have severe psychological stress. Here I have written physiological. Here I have written psychological. Psycho means in the mind. And here I have written physiological stress. Physiological stress means a trauma or stress which is in our body. That is known as physiological stress. Okay, a trauma or a pain into our body organs and body system, that is known as physiological stress. So how physiological stress will develop into our organs, into our system? Due to some trauma. Okay, if we have an accident and that is a major accident, there is a trauma and there is a sepsis. Sepsis means there is a infection in the blood, that is known as septicemia. Okay, that is also known as sepsis. And surgery, due to any major surgery, the ICP amount get increased. This ICP will stimulate the vagus nerve. Vagus nerve will stimulate the acetylcholine hormone, and this hormone will trigger our parietal cell to release more and more acid. Next, we have genetic predisposition. Okay, so this peptic ulcer disease condition is a hereditary disease condition. It means it runs into families on and on. Okay, so it's a genetic or it's a hereditary disease condition. Mostly the people who have blood group O, okay, especially O positive people used to suffer from duodenal ulcer. Okay, especially people who have O positive blood group, they mainly suffer from duodenal ulcer. It's a rare kind of blood group. Okay, so these were the causes and risk factor for the peptic ulcer disease condition.